Are you experiencing hair thinning or bald spots and wondering if you should see a dermatologist about it? Hi, I'm Dr. Mara Weinstein. I'm a board-certified dermatologist and I specialize in all things hair, skin, and nails. Today, we're talking all about hair loss and why your dermatologist should be your first stop for answers and treatment. So why see a dermatologist? Well, hair loss is multifactorial. There are so many things that contribute to hair loss. For example, hormonal conditions, genetic conditions, autoimmune reasons, or even nutrition deficiencies. Dermatologists are the physicians that specialize in hair and scalp disorders. So when we think about hair loss, there are really two main types. There is scarring alopecia, and alopecia is another way to describe hair loss, and there's non-scarring alopecia. And so if we think about those two broad categories, both can be very severe, both can cause dramatic hair loss, and both can be treated when you come to see a dermatologist early on in the progression of the disease. So let's first start with non-scarring alopecia. There are multiple different diagnoses when it comes to non-scarring alopecia, and basically this means that you're experiencing hair loss, but the follicle is not actually scarred down. There's still an intact follicle, so hair can be regrown through this follicle. Now, of course, with scarring alopecia, in these conditions, inflammation causes that follicle to scar down, so little by little, you develop scarring on the scalp in places where there used to be intact hair follicles, and essentially bald spots will form if not treated early. The most common conditions that we see in the non-scarring alopecia category are telogen effluvium, which means a rapid shed. And so many of you might have experienced loss of hair post-pregnancy, or even noticed thinning and loss of hair after having something like COVID. That hair loss is attributed to a condition called telogen effluvium, which means a rapid shed. So typically the hair grows in cycles. There's a growth phase, a rest phase, and a shedding phase. And those happen every 3 months or so. So that shedding phase can be prolonged if it's in response to some traumatic life event, like developing a viral illness, undergoing surgery, having a death in the family, having a nutritional deficiency, or anything that really jolts your system can contribute to telogen effluvium, which is that accelerated shed. And so if you had surgery, let's say in January, and you noticed more hair shedding in March, April timeframe, then it's most likely that your hair is shedding as a result of that stressful occurrence that was surgery. And so this sometimes is not hard to figure out, but it can be very frustrating when trying to take all the steps to regrow hair. One thing that I can assure you is if you're suffering from telogen effluvium, you will not go bald. You just need to take the necessary steps to help re-nourish that hair follicle and stimulate more hair growth. Another type of non-scarring alopecia is something called alopecia areata. Now, this is a condition that Jada Pinkett Smith, for example, made the public aware of, where she was developing patches of hair loss. With alopecia areata, hair falls out in a circular pattern, and although it's non-scarring, at times it's very hard to recover all of that hair loss. There are different gradations of alopecia areata. For example, alopecia areata, which are just those circles of hair loss, alopecia totalis, which is where you lose all of the hair on your scalp. And then there's a condition called alopecia universalis, where you lose all the hair on your body. Now, these conditions are all autoimmune related, and so they can occur in association with allergies, asthma, eczema, and don't necessarily tend to run in families, but you can get tests to determine whether you're prone to alopecia areata. And there are certain methods dermatologists can use to treat if you start developing patches of hair loss related to alopecia areata. Now, with scarring hair loss, there are multiple different conditions. And again, when addressed early on, they can really be successfully treated so that you don't develop scarred areas of hair loss. One of the most common conditions I see in the scarring alopecia category is a condition called traction alopecia. Now, traction alopecia is commonly seen in darker skin tones or patients who wear tight hairstyles, so tight ponytails, slicked back hairstyles, braids that are really pulling on the root, heavy dreads, and what a lot of people call protective styles can actually lead to scarring alopecia in the form of traction alopecia. Now, in this case, you're going to notice that there's sort of like a band around the hairline of thinning hair. And then the actual hairline will start about a few inches beyond the original hairline. In this case, our job as dermatologists is to employ treatments that will help regrow the hair, but also to really counsel the patient to maintain natural hairstyles and to remove braids and protective hairstyles that involve slick back or pulling a ponytail back really tight, or even wearing a hairband around the frontal hairline to sleep. There are a number of other types of scarring alopecias, but for the sake of this video, we're not going to get too far into depth on those. But the important point is, if you start to notice that there's inflammation on the scalp or a little bit of redness or pink, or there's a little scale around each of the follicles, or you're noticing big areas of hair loss or even small ones, don't hesitate to seek help from your dermatologist early on so that they can determine early on whether or not this is a scarring or a non-scarring alopecia, and whichever one it is, we can intervene early and employ treatments that will help you regrow your hair. Now let's get into some of the most common treatments that are offered. When talking about treatment related to hair loss, it's really that throw in the kitchen sink mentality. So there are multiple different things that we use to treat hair loss of all types. And so everything that I'm going to mention right now in terms of treatments for hair loss will be effective and helpful no matter what type of hair loss you have. And then once the actual diagnosis is made, then more specific treatments can be prescribed and suggested for different types of hair loss. So first things first, in order to grow hair, we need to make sure that the scalp is healthy. It's sort of like gardening, right? So you need to make sure that the soil is fertile and healthy and gets watered so that your plants will grow. You can think of that similarly to the scalp where your hair follicles are. It needs to be healthy, free of inflammation, free of debris, free of dirt, and really we need to create an optimal environment for hair to grow. So how do we do that? First of all, we address the scalp itself. So most people have a little bit of yeast on their scalp, and in some that can look like dandruff or flaking, which can also be itchy. And so if you're somebody who has dandruff and is starting to notice some hair loss, then the first thing we're going to do is recommend treating that dandruff. Now, even if you don't have dandruff, dermatologists like myself recommend using a shampoo that contains zinc pyrithione in it, which helps to nourish that hair follicle. These shampoos will be marketed as anti-dandruff, and one of the most common ones is actually by Head & Shoulders. Most of you already know of it, but something like Head & Shoulders can be really helpful to cleanse the scalp, especially if there's yeast buildup. Now, I recommend using this at least 2 or 3 times a week in the shower, depending on how often you shower. If you wash your hair more like once a week, then I recommend adding something like Head & Shoulders to your hair cleansing routine. Head & Shoulders just came out with a great new line called Bare, and this is a really nice product to reach for. It's free of chemicals and parabens, and it's safe for color-treated hair. It's going to nourish and hydrate the hair and can be easily combined with other shampooing and conditioning routines. Now, there's other brands that make some great anti-dandruff shampoos like CeraVe or Dove, and one of my favorites is Jupiter. There's also a brand called Nioxin that's specifically formulated for thinning hair, in addition to a brand called Heritage. So all of these are great options, and just remember we're looking for that key ingredient of zinc pyrithione. So we talked about keeping the scalp healthy and making sure there is no dandruff or buildup or inflammation on the scalp. The next thing we need to think about is our nutritional state. So believe it or not, the things that we eat can affect whether or not our hair that's growing on our head is healthy. And I'm sure you've heard of this, right? If you're malnourished, your hair is not going to be healthy, your skin's not going to look great, and you're not going to feel good overall. And so there are some key nutrients that we know will help nourish the hair follicle and help promote that hair regrowth. So the first one is vitamin D. We recommend taking at least 2,000 units of vitamin D daily. Now, of course, you should check with your primary care doctor and make sure you don't have too much vitamin D. So this is something that we can check as dermatologists in your blood work. But just to be safe, 2,000 international units of vitamin D should be fine. And that's something you can start right away taking every day to help with your hair and your overall body. The second ingredient that is essential to hair regrowth is iron. And so a lot of people who have vegetarian or vegan or pescatarian diets, or even if you have a regular diet, most people don't eat enough lean red meat. Now, I'm not saying eat something like a steak or hamburger every day, but at least once a week eating something with lean red meat. Some other great sources of iron are molasses and lentils, or any beans and leafy greens. So these are all great ways to make sure that you have enough iron in your diet. And you guessed it, iron is something else that we check in your blood to make sure that you're not deficient. Now, the next ingredient, which is highly controversial that a lot of people attribute to hair regrowth, is biotin. Now, biotin can be helpful, especially when combined with other B vitamins and vitamin C, but as a standalone vitamin, it actually can be harmful. And we know that because in very high doses, biotin can affect your blood work. So if you're somebody who has thyroid issues or is getting monitored regularly for thyroid disease, biotin can actually obscure that lab value. So we don't recommend taking high doses of biotin by itself. But there are some combo capsules and vitamins that are specifically formulated for hair regrowth, like Nutritional and Viviscal. And we do recommend that you take one of these all-encompassing nutritive vitamins, or we call them nutraceuticals. But we do recommend that you take one of these nutraceuticals to help with hair regrowth. Now, there's also hair, skin, and nail gummies or over-the-counter vitamins that are formulated for hair regrowth. Any of these are fine, but as a dermatologist, I typically recommend Nutritional or Viviscal. And we'll put some links below to help guide you on where you can find these. Another easy thing that you can start if you're noticing hair thinning or hair shedding is Minoxidil. Minoxidil is an over-the-counter ingredient that helps keep your hair in the growth phase. You can apply it directly to the areas where you're noticing hair loss, or you can apply it all over if you feel like you're diffusely thinning. We recommend purchasing Minoxidil 5% foam, which is available over the counter. Doesn't matter if it says men's or women's, both will do the job, but just apply that thin layer every night to the areas where you're noticing hair loss. Now, there is a common myth that Minoxidil will actually cause hair loss. And it is true that when you first start it, you might notice increased shedding. And that's because you really have to understand the mechanism of Minoxidil. What it does, remember in the beginning when I told you that the hair grows in cycles, there's a growth phase called the anagen phase, there's a shedding phase called the telogen phase, and there's a resting phase called the catagen phase. What Minoxidil does is it helps promote all of your hairs to grow in that anagen phase. And so the hairs that are resting and the hairs that we're about to shed are going to follow it anyway. So that'll be the initial shed you see from Minoxidil, but then eventually all the hairs will come up in the anagen phase and your hair will appear thicker and it will stay more dense so long as you're using it. Now, if you stop, right, of course, the hairs that we're going to fall out will fall out anyway because our hair grows in cycles. And so it is something that once you start, we recommend continuing for as long as that period of whether it's a telogen effluvium phase or you've gotten some inherited pattern balding or shedding, we recommend you use it as long as you're noticing that hair shed. Now, there are some medications that we can prescribe in the office that aren't available over the counter, and these can help with hormonally regulated hair loss or an inherited pattern hair loss. And I'm just gonna list them, but really in order to properly use them, they have to be prescribed and you have to be counseled by your dermatologist prior to taking them. So these are medications like spironolactone, which helps block androgens, which can help particularly with female pattern hair loss. There's another medication called finasteride, or the brand name is Propecia. That can be very helpful with male pattern hair loss. There's also an oral form of Minoxidil, so a Minoxidil pill that a lot of patients prefer to take because they don't like putting stuff on their hair every night. And so that, if you're interested, is something that you need to see your board-certified dermatologist or primary care physician to determine if you're an appropriate candidate for an orally prescribed medication. Now, another brand new treatment that we're using for hair loss, something else that we're doing in the office for hair loss is called PRP, which stands for platelet-rich plasma. And so in this case, you're coming into the office, we're drawing your blood, we're spinning it down and extracting that platelet-rich plasma and then injecting it back into the scalp. Now, this procedure and technique has been thoroughly studied and vetted for over 10 years, and it can be very helpful in providing those nutrients, platelets, growth factors, fibroblasts, exactly what your follicle needs to regrow hair. Now, this is something, like I said, that needs to be done in the office because you can imagine it needs to be done in a sterile environment. We're drawing blood, we're injecting it into the scalp. Typically, patients come in every month for this for up to 4 treatments, and then we do maintenance treatments every 6 months. Something else that is all the rage right now are exosomes. So exosomes can be very helpful for hair regrowth. Again, it's something we're doing in the office, either combined with a procedure like microneedling and then applying the exosomes topically to the scalp, or just applying them on their own. And this again is being done every month for up to 4 months and then repeated every 6 months. Eventually, we're hoping that we have a product that's been vetted and well-studied and clinical research side to give you to take home and use so that you can use an exosome-based serum or something similar daily in the interim. One of the last things that can absolutely contribute to hair loss is stress. I know you didn't want to hear it, but stress. So the unfortunate thing that happens is once you start noticing hair loss, then you're worried about it and you're stressed about it. And we see this all the time in patients, and it just takes over your whole being. And I get it. It's stressful and it's disheartening, and it can cause some social anxiety. If you feel like your hair is shedding and thinning, you don't feel like yourself. But I promise you that increased cortisol related to stress can worsen that hair loss condition. So whatever you need to do to decrease your stress, take notes from this video, all the things we talked about that you can start at home, and then do things like regular exercise, yoga, meditation. Whatever you can do to decrease your stress will really help your follicles reboot so that you can grow your hair back. Now, lastly, when to seek help. So if you've noticed that your hair is thinning, or you have bald patches, or your hairline is receding, or if you part the scalp and you see a bunch of redness and scale on the scalp, and you've tried the shampoos we recommended and it's just not getting better, don't hesitate to pick up the phone and call your board-certified dermatologist. You might have to make an appointment with your primary care doctor first, and they'll send a referral to see us, but at least they can check some baseline labs and make sure that everything in your system internally is doing just fine, so that we can address little by little what the triggers might have been that caused the hair loss in the first place. Don't wait until your hair loss is severe. Early intervention and diagnosis are key. Any questions about your hair health? Well, don't hesitate to drop them in the comments below. And if you enjoyed this video and want to see more science-backed skin and hair care related advice, make sure you like and subscribe and share with someone you think this could be helpful for. Take care. Thanks for watching.